Okay, welcome to this A-level Section 8 anthology video, and this is Ethics from Wilcockson, and we read and then we analyse. Point 3, ordinary and extraordinary means. The principle of ordinary and extraordinary means is used both by the weak sanctity of life, WSOL, arguments, and the quality of life proponents. Another possibly better way of considering the issues in terms of proportionate and disproportionate means. In the natural law tradition, a person who refuses food and water in order to die has deliberately committed suicide, which is condemned in Roman Catholic theology as a mortal sin. But a person is within their rights to refuse surgery on the grounds that it's over and above what is needed ordinarily for bare existence. The BMA, for instance, say competent patients have a right to refuse any treatment, including life-prolonging treatment. Nature is allowed to take its course. The doctor is not involved in the direct cause of the death of the patient. Those who criticize this suggest it's a form of passive euthanasia or even assisted suicide. For instance, if a doctor withholds life-sustaining treatment against his or her better judgment, but through respect for patient autonomy, the result might be condemned either as an act of professional negligence or willful killing. Okay, so let's look at this. So is the principle of ordinary and extraordinary means, what is it? And is it a significant ethical issue? Well, this principle concerns the lengths one is obliged to go to when preserving life, and it relates to what counts as proportionate and disproportionate means. While suicide has been traditionally condemned by proponents of the sanctity of life, equally some have recognized that people do have limited autonomy to determine how they wish their lives to be. The conception is in Roman Catholicism, in natural law tradition, one is obliged to preserve his or her own life by making use of ordinary means, but is not under any obligation to use extraordinary means. Peter Vardy on this says, this was particularly important in the days of warfare before anesthetics, when a decision could be made to forego amputation, even if this meant the death of the individual. Interesting. So, extraordinary, if we compare these two words in ordinary, extraordinary means effectively means disproportionate means. In other words, means of attempting to save a life which were out of proportion in terms of the pain and the degradation suffered to the possibility of prolonging life. The major problem is what is decided to be extraordinary means, and in relation to what is this to be measured? Is it the length of life? Is it the quality of life, the pain endured because of the procedure, etc.? Ordinary means has been taken to include air, food, and water. That's interesting. Ventilation. If this is accepted, then it can never be permissible to deprive someone of these, even if they are in a persistent coma, and even if these have to be administered in ways that are highly invasive. Becomes tricky, especially around ventilation. And actually food and water, if you have to have it piped into you, do you continue to have it piped into you if you can't eat it yourself? When is it really just nature? And what does it mean to say nature is allowed to take its course? Especially when we can do these invasive type procedures for ordinary sustenance like food and water. So the weak sanctity of life principle. Let's look at this weak sanctity of life principle up here. What is the weak sanctity of life principle? Well, it's a sort of slightly relativist, typically Protestant, most typically Church of England maybe Methodists, although they can be even more radical, just been into quality of life thinking. And it's an argument that euthanasia is acceptable when their life is so poor, is indifferent from the quality of life argument. Well, it could be said, is it really the quality of life argument by another means? Or is it to respect life but allow the doctrine of double effect, i.e. high dose of morphine is given to avoid pain but it speeds up death and is acceptable? So that's a sort of weak sanctity of life. A strong sanctity of life principle, typically what the Catholic Church has said in this 1980 document, is very absolutist. And we could think Kantian as well, has been described as a vitalist theory, a pro-life, a strong sanctity of life principle. And such followers argue there is no exception, that life cannot be taken, as the soul is the sacred gift from God. Even from as early as conception, the soul exists, must be preserved. And this is in this Catholic Declaration in Euthanasia from 1980. So we move on. Quality of life proponents. Well, that's Fletcher in the 1950s and 60s, Peter Singer more recently, Dignity in Dying, and the list could go on, of your radical, liberal, humanist ethicists. Life on this view has not intrinsic moral value, as in the strong sanctity of life principle, but instrumental value. It's value because what you can do. Life has not only instrumental value, but extrinsic value. You can look at particular things, your autonomy, your awareness, your dignity. So if life is thought on this view to be not worth living, if someone has lost everything that makes their lives worthwhile, even subjective things, Peter Singer says, this means you feel your life has no worth, because human life depends on its quality. So someone has low quality of life, they're justified in committing suicide or euthanasia. I've talked a lot about the natural law tradition, and it gave rise to the Catholic Declaration on Euthanasia. And the idea of proportionate and disproportionate means is discussed in that document. So it represents the official moral position of the Church on euthanasia, and it's really a form of the Roman Catholic magisterium, the teaching authority in Rome. Even though it's not an infallible teaching, it is still the normative teaching of the Catholic community. This moral position calls for the presumption of truth on the part of the faithful, who ought to attend carefully to this teaching. Since 1990, all Catholic priests prior to ordination, except for members of a few religious orders, have to sign an oath giving religious assent of will and intellect to all the teachings of the magisterium. So it's what priests must sign. This means the magisterium's teaching is effectively binding on priests, and Cardinal Ratzinger, the head of the Holy Office, has said this teaching must be accepted by the laity as well at the time when he was in that role. So he wants to go further. He's the Rottweiler of the Catholic Church. If you look at the details of this Catholic Declaration from 1980, it talks about the value of human life. Recognize that people have intrinsic moral worth. They are something sacred. And then it supplies three norms for this. First, the universal prohibition against attempts on the life of an innocent person. And it would class either by acts or by omissions any intentional act to end a person's life. The second norm is the universal duty to live in one's life in accord with God's plan, that human life is to be fruitful and to find full perfection, and will only find its full perfection in eternal life. Again, they're not materialists. This life isn't all there is. And lastly, the prohibition on euthanasia is back in there. Now, the document recognizes that the world has different means for different people. It defines euthanasia as an act down here, an act or an omission which of itself or by intention causes death in order that all suffering may be eliminated. So it's just not permissible for one person to do this to another or to ask for it for oneself, even when this request comes from the experience of prolonged and invariably intolerable pain. That's still an act or an omission to take life. The intention is to end life, and then that's murder, that's wrong. The document holds that the pleas of gravely ill people who ask for death should be seen as anguished plea for help and love, not only in terms of medical care, but also for human and supernatural support and comfort. So the meaning of suffering for Christians and the use of painkillers is really important here. This discussion of pain and what is condemned because of it's just a focus on pain. The Roman Catholic Church's mortal sin. So if you because of your pain, refuse food for yourself in order to die, that's suicide because you feel that you don't want the pain. Well, whilst seeing that some things, prolonged illness, advanced old age, bring about psychological conditions that facilitate the acceptance of death, nevertheless, death is something which naturally causes people anguish. Suffering may so exceed its biological and psychological usefulness that it can cause the desire to remove it in any way at all, at whatever price. It accepts that only very few who can limit the dosage of painkillers to associate in a conscious way with the sufferings of Christ. Most people want to use painkillers and may do so through the drugs to reduce consciousness and shorten life. Death is then a byproduct of the pain relief principle double effect. The document says it's important to protect at the moment of death both the dignity of the human person and the Christian concept of life against a technological attitude which threatens to become an abuse. The document interprets the phrase "the right to die" as rather the right to die peacefully with human and Christian dignity. Decisions about how the ill will live whilst dying should be taken by the sick person. The document cites with approval the alternative distinction between proportionate and disproportionate means. So as we've seen, disproportionate means to preserve life in order to gain when the gains of continuing life outweigh the cost to the patient and is unnecessary. So going back to these ideas of proportionate and disproportionate. So clearly, to refuse surgery on the grounds that it's over and above what is needed is fine for bare existence on this Catholic theology. But the BMA are saying something slightly different. So proportionalism, proportionate and disproportionate mean euthanasia, we've mentioned. It is the Declaration's basic approach, this is the Catholic Declaration, to applying the traditional principle of ordinary and extraordinary means when solving dilemmas affecting the duration of life. It advocates the weighing of relative values such as risk, cost, burden to the patient, and benefit. It recognizes some means are disproportionate and result. And this is when the individual may, in good conscience, refuse forms of treatment that would secure precarious and burdensome and prolongation of life, so long as the normal care due to the sick person in similar cases is not interrupted. So, coming into land here with some of this stuff, the BMA says a competent patient has a right to refuse treatment. Let's give it a different color. Has a right. What is our right? A competent patient has a right to refuse any treatment. But it's any treatment. Here's this word here, any treatment. That's where the Catholic Church demurs. You can, on the Catholic view, refuse disproportionate means. You can't refuse proportionate means that would prolong your life. because that would be a form of suicide. So allowing nature to take its course is a really slippery term here. When is it? Because what it hides is the intention of the doctor and the intention of the patient, and so on. Is the doctor involved or not involved in the direct cause of death of the patient if they don't do kind of disproportionate things? Well, probably not. But if it's proportionate stuff, what is proportionate stuff? That's a useful kind of measure to kind of think through this stuff. So those who criticize this, that's this document we've just been talking about, the 1980 Catholic document, say that it's possible to disguise passive euthanasia or even assisted suicide if you are intentionally refusing proportionate treatments. Whether it's by a doctor who deliberately withholds life-sustaining treatment, or a patient who refuses life-sustaining proportionate treatment. That adds up in the Catholic sanctity of life thinking to suicide, and that's a mortal sin. That's wrong. But if we respect patient autonomy, well, let's have a look at this. There's a grey area between medical authority of doctors and the free will autonomy of the patient. What has the patient got autonomy to choose about? Well, so while it could be said that it's a sin under the sanctity of life argument, a patient refusing treatment or a doctor insisting on a treatment that would prolong life would be seen as virtuous by quality of life supporters. Well, of course it would be. It would be seen as a good thing because it's, even if it's proportionate, because it's subjective. I don't like my life. Please don't give me even proportionate support. I want to die. Or your life isn't worth living. I'm not even going to give you proportionate medical treatment. Never mind disproportionate. So what's your view? Is it an act of professional negligence, or, well, let's get a different color, willful killing? The doctor who refuses to give proportionate medical treatment, whatever that is. Now, Wilcockson will report various cases of this. The BMA allows competent patients to refuse treatment. Again, here's this tricky word. What do we mean by treatment? Proportionate treatment or disproportionate treatment, which will prolong their lives. Can I refuse food and water? Well, can a doctor make you? That's a really interesting question. But if you're a sanctity of life thinker and you refuse proportionate treatment, well, that's a sin. So this kind of fact can be seen as letting nature take its course. But what does that mean? It's all to do with intention. It's a very slippery term, this. Yet an argument which places the idea of the doctor's intervention as a purely artificial means might deny a doctor the autonomy to save a patient. If a doctor, for example, withholds treatment from a cancer patient on the patient's wishes, they may be guilty of negligence or, at worst, willful omission resulting in assisted suicide. So is it professional negligence or willful killing? This can encompass proportionality. So I refuse proportional means. The doctor isn't strictly bound to the patient with the most extreme possible measures, but instead to find what could be considered a compromise towards the good of both the patient and the doctor. A lot of grey stuff here. But once you kind of pin it down, sanctity of life thinkers know fairly well what counts as a sin, as it were. And the quality of life supporters will push the boundaries as what they think of as virtuous, to include a proportionate, refusing or to give proportionate means of support. whatever that is. Okay, so this was section 8.